This is the Gestational Diabetes PowerPoint by Destiny, Megan, and Terry. Pathophysiology. Gestational diabetes is glucose intolerance with onset or recognition of during pregnancy. It is different than other forms of diabetes because the duration is limited, meaning it usually resolves after delivery, but the pathophysiology is similar to other forms. In the early stages of pregnancy, hormones such as estrogens and progestins and other pregnancy-related hormones can lower glucose levels. As pregnancy progresses, postprandial glucose levels steadily increase, while insulin sensitivity steadily decreases. For the glucose levels to be maintained normally during the pregnancy, maternal insulin secretion is supposed to increase to prevent the fall in insulin sensitivity. Gestational diabetes happens when insulin secretion is not sufficient to prevent pregnancy-related decrease in insulin sensitivity. Although the exact cause is unknown, there are some risk factors, such as maternal age greater than 25, maternal weight being overweight or obese category, non-Caucasian ethnicity, family history of type 2 diabetes, prediabetes, and if a woman had gestational diabetes during a previous pregnancy. Clinical manifestations. There might not be symptoms, and they might not know they have gestational diabetes, which is why all pregnant women are screened for it. The symptoms of gestational diabetes can be exacerbated common symptoms of pregnancy. Pregnant women with gestational diabetes might notice they feel thirsty more frequently than they normally are. They might feel more fatigued and have a dry mouth, which can be related to increased thirst. They might also complain of tingling in the hands and feet or blurred vision. Complications. Extra glucose can cause the baby's pancreas to make extra insulin, which can cause the baby to grow too big, resulting in a large for gestational age newborn. Hypoglycemia of the newborn can happen due to the baby's insulin production being too high. Babies with mothers that had gestational diabetes have a higher risk of developing type 2 diabetes later in life. If the mother is having uncontrolled high blood sugars, this can increase her risk of going into preterm labor, and the baby can develop respiratory distress syndrome due to prematurity. Patient-centered education. First and foremost, we always want to assess our patient's level of education and learning styles and have appropriate teaching materials handy. Next, we want to teach normal blood glucose levels, 80 to 130 milligrams per deciliter for fasting glucose checks, or 2 hours after meals, blood glucose levels should be less than 180 milligrams per deciliter. For glucose monitoring techniques, we want to teach what the equipment is, how it works, and how to check blood sugars, when to check glucose levels, first thing in the morning, before or after meals, bedtime. For insulin administration, we want to teach how to draw and prepare the insulin and proper injection techniques and locations. For healthy food choices, we would teach to avoid processed sugars, choose complex carbs over simple carbs, and foods high in fiber and protein. For treatments. Lowering sugar in the diet is one of the best approaches for treatment for gestational diabetes, and it is also the most easily accessible. Exercise is another way to lower blood glucose levels, although pregnancy can make this more difficult. Women should either continue their pre-pregnancy exercise routines, or if they did not exercise prior to being pregnant, they should stick to low impact exercises such as aerobics or moderate walking. Medications such as insulin can be used to lower blood glucose levels if other approaches are not helping. These treatments can help prevent or decrease complications. Outcomes and expectations. If managed correctly, most women with gestational diabetes deliver healthy and normal babies. There are more complications related to high blood sugars and not managing glucose levels correctly. After pregnancy, the mother will turn to a normal state. She will not stay diabetic after pregnancy. NCLEX question 1. A pregnant woman is newly diagnosed with gestational diabetes and has just been educated by the nurse regarding interventions and treatment. Which statement requires further teaching? A. Exercise can help lower my blood sugar. B. Using my insulin as prescribed will lower my blood sugar levels. C. Lowering the amount of sugar in my diet is best approach for treatment. Or D. If my blood sugar is high, drinking juice or eating a piece of candy will help lower it along with my insulin. The correct answer is D. Juice and candy have sugar in them, and if blood sugars are already high, this will only increase glucose levels and increase the risk of complications. NCLEX question 2. A 29-year-old pregnant woman at 24 weeks gestation is diagnosed with gestational diabetes. What is a potential complication of this diagnosis? A. LGA newborn. B. SGA newborn. C. Pyloric stenosis. Or D. Down syndrome. The correct answer is A. A potential complication of gestational diabetes is a large for gestational age newborn due to the excess glucose in the mother's bloodstream. Here is our reference page. Thank you for listening to our presentation. Enjoy the rest of your day.